Good morning, good afternoon, good evening, wherever you're tuning from. My name is Stephen Dimba, co-founder and CEO of Klinik telehealth, currently in Nairobi, Kenya. Klinik is a digital health platform designed for the young, the underserved, and those overlooked. Today, allow me to challenge a comfortable illusion that the next 1 billion people will enter healthcare system designed for them. They won't. They are already currently rerouting around those systems. We're watching a generation that won't wait in line, won't tolerate gatekeepers, and won't keep quiet when systems fail them. This is not a cultural shift, but it's a structural warning. So what problem are we grappling with facing currently? Across emerging markets, three truths collide. Walk with me. Number one, health systems are collapsing under demographics that weren't built for. An example, a 22-year-old, 23, 25-year-old in Nairobi, Lagos, Kampala consumes healthcare differently compared to their parents. Yet, she's offered the same analog pathways, queuing, stigma, and out-of-pocket expenses that are unpredictable. Number two, digital adoption is accelerating faster than healthcare adoption. Gen Zs are mobile-first population. They're financially strained and mentally overstretched. But the health system still expects them to behave like compliant parents in a brick-and-mortar institution. Third truth is, the biggest unmet gap isn't treatment, it's access. Access to healthcare, access to psychosocial support, access to trust. Let me drill deep to this. And without trust, AI, telehealth, or digital diagnosis means nothing. This mismatch is widening. Not because of technology, but because of who technology is designed for. We are in a generation that won't wait. And let's be clear. Young people are not underserved because they are hard to reach. They are underserved because the systems are slow to evolve. This generation treats time as currency. They have no loyalty, only focus on outcomes. They consume health advice through TikTok before even textbooks. And they will choose a WhatsApp conversation with a stranger over a hospital line with a specialist. We are facing the highest mental health burden recorded in the continent as we speak now. If we design healthcare for what worked before, we lose them. If we design for what they already do, we create next global health advantage. So what does Klinik do as a strategic core? We are not here to fix the system. We are here to build access layer that bypasses the bottleneck. So we do three things which are critical for survival and entrenching the market. We connect young people directly to verified clinicians instantly. So they are able to get telehealth consultation, therapy, psychosocial support, sexual health and reproductive care, GBV support for gender-based violence survivors, all this accessed via their phone. USSD, SMS, WhatsApp. We remove financial friction and allow the young people to plan their spending. So we introduce microloans, pay later options, and health savings in a wallet mapped to their real behavior. No theoretical insurance models, but actual liquidity. Third that we do as Klinik is we build digital rails for pharmacies and local providers. Let me bring this home. In Africa and especially in emerging markets, when people become unwell, the first stop is never the hospital. is always the neighborhood pharmacy, your moms and pops shops in the healthcare framework. That's normally their first stop. And that's where they get their first consultation, if they have to. So what Klinik has done, we've built a rails around this pharmacy. They become our agents that onboard this population onto our platform, and eventually they access telehealth healthcare easily. We are leveraging on the trust they have with the local pharmacy, and now we embed it onto our platform. The result? A system where the front line becomes faster, costs become predictable, and lastly, young people meet healthcare where they already live, online. So why does it matter for the next 1 billion? Or the next billion for the most part? We're not designing for Africa alone. We're designing for the global future most advanced economies are about to confront. We are looking at a young population that's demanding digital first care, an economic precariously shaping health decision, mental health dominating the burden of diseases, and an AI amplifying both opportunity and inequality. The next billion users entering the global health ecosystem are not compliant, patient, insured, nor wealthy. They are entrepreneurial, they are stressed, they are resource constrained, and above, they are powered by mobile connectivity. If we resolve access for them, we resolve access for everyone that comes after. So where does AI fit in all this framework? AI is not the solution. And I repeat, AI is not the solution. AI is the multiplier. Only after the fundamental works has been done. So here is what truly moves the needle. AI triage that reduces clinicians' workload without removing clinicians' judgment. That's very critical. Behavioral models that predicts when a young person will drop off care and intervene early. Population level insights that reveal silent epidemic in real time. And lastly, secure architecture that protects survivors of gender-based violence or young women seeking reproductive care. AI is powerful, but without trust and access, it becomes another burden. So Klinik advantage is not in algorithm. It's in the ecosystem we've built for AI to actually land. So if you're in this particular framework or in this particular meeting today and you're an investor, don't wait for the sector to mature. The next billion users are already here. If you're a policymaker, kindly integrate the youth, mental health, and digital microfinance into the national health strategy. Not as appendices, but as core pillars. If you are a researcher in the University of Institute of Higher Learning, build evidence models that capture real behavior, not idealized patient pathways. And lastly, if you're an AI innovator, co-create tools that actually function in low trust, high demand environment. Because the real question is not, can we re-engineer healthcare access? It's, do we have the courage to build systems that serve the people who refuse to wait? We are not just digitizing healthcare as Klinik. We are rewriting who gets access to it, when, and at what cost. The next billion are already rewriting the rules. Our job is to keep up. Thank you.